what are the most common infection worries for people traveling in the UK? Are there many? We talk about far-flung exotic travel, but what about simple UK travel? That's a brilliant question.
That's a brilliant question. Do you want to start with that, Chris?
What would be my laundry list of things? So it very, very much depends on what you're doing. So if you are staying in five-star hotels up and down the UK, you are at no more risk of getting anything than you are just living elsewhere in the UK. If you're wild swimming, there is a significant risk, I would say, of waterborne disease almost no matter where you're doing it, in the sea or in rivers. And if you get diarrhea afterwards, we're happy to see you at our post-travel service at UCLH. And you can get, there are a number of bacteria that are fecally transmitted. Lyme disease is a concern in some parts of the country, transmitted by ticks. Other infections that we want to worry about? What do you want to talk about? Watercress in,
Go for it.
there are very, you can in theory, I guess, it's slightly expanding infections and other things, not infections. Food foragers,
Yeah.
we do see. So if you're foraging watercress, you can get a fluke, a liver fluke.
Yeah, I would say sort of if you go across bits of Northern Europe that you wouldn't necessarily think of, we've had sort of incidents of the echinococcal hydatid disease from people foraging. This is a sort of horrible cystic liver parasite that people can get from eating wild strawberries in bits of Switzerland and across Northern Europe. I'm not sure how many cases have been linked to the UK, but certainly places outside of that aren't in supposed high-risk settings. I guess we were talking earlier about something called leishmaniasis, which is another parasitic infection that people who are older or have myeloma or other hematological problems are higher risk of, and we've seen increasing cases of that from Spain and Greece. So that's, let's not get paranoid. But
I mean, washing fruit that is at low level is generally a good approach to everything, isn't it?
Yeah.
I'm trying to think of anything else we think about in the UK. I mean, there are, if you're nerdy about it, we are starting to see some of the mosquito-borne viruses move up Europe. So we now have transmission of chikungunya and dengue in southern Europe.
Very few cases. I think it's very few cases. I don't want to sort of start a sort of a big concern. I think more worrying than that is things like you occasionally see these outbreaks of E. coli or the E. coli 0157 that you see from petting farms in with children who sort of touch sheep in the UK and then get a horrible sort of E. coli illness from it. So I think again it's about
raw milk. People drinking raw milk on holiday. We know people who've done that. That's always a risk, even if you're buying it from the farm gate.
Yeah.
But the UK is pretty. It's a pretty. I think we're both having to rummage quite hard here to find. There are other risks in the UK. Probably mainly our motorways are going to be the main risk.
That's a good